This video shows the technique for making a single appointment bridge using ribbon reinforcement fiber, which is perhaps the most common ribbon application worldwide. These bridges are quick and easy to make and very well received by patients. Please note that this video is intended to provide an overview of the procedure and that it is not intended to be used in lieu of the instructions that are included in the ribbon kit. A ribbon bridge can be made either intra or extracoronally, depending on the particulars of the specific case. This video shows a case without preparations to the abutments. Whether preparations are used or not, the technique for making the ribbon bridge is more or less the same. If the abutment teeth are periodontally mobile, the ribbon wings can be extended to multiple abutments. First, you will need to decide what to use as a pontic. If you just extracted a natural tooth, you can use it as the pontic. You can also make a pontic using an acrylic denture tooth or a freehand composite buildup. You will want to choose and shape the pontic prior to making the ribbon framework. Measure the area where the ribbon will be placed using the dead soft tinfoil provided in the ribbon kit. Waxed dental floss can also be used as well. Then cut the ribbon to the corresponding length. A small amount of tacky composite can be used to help hold the template in position. 2 layers of ribbon will be used for making the bridge framework. The first layer will extend from abutment to abutment. The second layer will double up against the first layer only in the pontic area. Adapt the tinfoil or dental floss to the teeth as you would adapt the ribbon. Cut or mark the end of the template to indicate the length that will be needed to cut the ribbon. Please note, you may want to err on the side of cutting too much rather than cutting too little, as you can trim the excess ribbon with the special ribbon scissors before polymerizing. Cut open the plastic packaging and use cotton pliers to extract the ribbon. Cut the 2 ribbon pieces with the special ribbon scissors. Ribbon is made from the same ultra-high molecular weight polyethylene fibers used to make bulletproof vests, and normal scissors will not cut it cleanly. Reseal the ribbon by folding over the end of the packaging and securing it with the paperclip. This will help maintain ribbon's indefinite shelf life. Clean the teeth and prepare the teeth for bonding. Clean and acid etch the teeth and apply the bonding adhesive using your standard bonding technique and materials. Please note that since there is no clinical evidence supporting the use of self-etching resins for this type of retentive bonding, we do not recommend using self-etching resins for this procedure. Apply a thin layer of ribbon securing composite or soft filled composite to the teeth. We don't recommend using a flowable composite for this step because flowables tend to lack the tackiness to hold the ribbon in position prior to curing. Ribbon Incorporated has a specially formulated filled composite resin designed for bonding the fibers to the teeth. It has a viscosity that is between a flowable composite and a filled restorative composite. This video shows the technique using the ribbon securing composite. If you do not have the ribbon securing composite, we have a list of some of the composite resins from major manufacturers that we recommend for this step of the procedure on our website. If using a paste viscosity composite, place a thin bead of composite on the teeth and then with an instrument flatten it to mimic the contours of the teeth. Flattening the composite will make adaptation easier and reduce the amount of composite that needs to be displaced when placing the ribbon. Try to make this layer approximately 1/2 millimeter thick. Wet the first piece of ribbon with a 4th generation unfilled adhesive bonding resin. After the ribbon is wetted with the bonding resin, you can now touch it with your fingers or powder-free latex gloves. Do not wet the ribbon with a bonding resin that contains a dentin primer or self-etching component. If you do not have a suitable resin already in your office, Ribbon Incorporated offers ribbon wetting resin, which is specifically designed for wetting ribbon fibers. Hold the wetted ribbon with cotton pliers, and starting at one end, press the ribbon into the composite resin that was previously applied to the teeth. Use your fingers or instruments to press the ribbon through the composite closely against the tooth surfaces. Remember, the thinner the bond line is, the better the results, so try to displace as much composite as possible. This will not only minimize bulk and aid in patient comfort, but it will also maximize the laminate effect and increase longevity. Use cotton pliers and bring the ribbon across the edentulous area and adapt the ribbon into the composite on the other abutment. Again, place the ribbon as close to the surfaces of the teeth as possible. If the ribbon piece is too long, cut the excess with the special ribbon scissors prior to curing. Try to make the ribbon cross the pontic space in a straight line and orient the ribbon so that it is placed under the incisal edge of the pontic. This way, the forces from the pontic will be directed onto the ribbon framework. After placement, using the same thin-tipped instrument, carefully remove the excess composite resin that was displaced during the adaptation of the ribbon. Move the instrument parallel to the lengthwise orientation of the ribbon to avoid accidentally displacing the ribbon. After the first piece of ribbon is adapted, polymerize the framework according to the composite manufacturer's instructions. Wet the second piece of ribbon with a bonding adhesive that does not contain a dentin primer or acid etchant. Place a thin layer of the same filled composite that we used earlier for the procedure on the lingual side of the ribbon in the edentulous area. Extend this composite layer onto the interproximal angles of both abutments. Gently place the ribbon against the layer of composite. Try to maintain a 0.5 mm thickness of composite resin between the two layers of ribbon. Polymerize the second piece of ribbon. If using an acrylic denture tooth or a natural crown as a pontic, cut a lingual channel to accommodate the ribbon framework. If using an acrylic denture tooth, you will be relying on mechanical retention, so make undercuts within the groove preparation in the acrylic denture tooth. Small holes can be placed in the groove for added mechanical retention using a small burr. Fill the groove with composite, seat the pontic on the framework, check placement, and polymerize. Cover the ribbon within the channel of the pontic with composite to build up the lingual side of the pontic. Cover the lingual surfaces of the ribbon wings to make the prosthesis smooth and comfortable to the patient. For extracoronal applications, we recommend a flowable composite for covering the lingual wings of the abutments. This can be applied in multiple layers using a micro brush or other small brush to make the wings smooth and comfortable for the patient. Do not use the ribbon securing composite for the covering layer, as it is too tacky. Ribbon fibers do not polish well, but they need to be covered with resin. You want to avoid having to shape and polish the prosthesis using rotary instruments. When the covering layer is finished, thoroughly polymerize.